I'm Dale Corpus, a Senior Transition Specialist, and I help families navigate the often overwhelming process of selling a senior's home while transitioning them into the right living environment. And one of the biggest concerns families have is choosing the right senior living community. And that's where today's guest comes in. I'm joined today by Tanvi Ganga, a senior living placement agent and expert with Neighborly Senior Placement, who has helped countless families find the best care options for their loved ones. Today, we're going to dive into one, how to choose the right senior living community, two, common mistakes families make when searching for senior care, three, how working with a placement agent makes the process easier, and four, what families should do first when considering senior living, and much more. If you're feeling lost in this process, you're in the right place. Let's get started.
Welcome to the Simplify Senior Transitions podcast, where we help families navigate senior living, real estate, and everything in between. Hosted by Senior Transition Specialist Dale Corpus, this show brings you expert insights, real solutions, and stress-free strategies to make senior transitions simple. Ready to dive in? Let's go.
We are back and we have Tanvi with us. So, Tanvi, welcome to the show. How are you?
Thank you. Thank you for having me, Dale. I am good. It's a beautiful, lovely Sunday morning. So I am very excited to just dive in and
Yeah.
yeah.
Well, hey, tell us a little bit more about yourself. How did you get into becoming a senior living placement agent?
Great question. I do get asked this question a lot. So before joining Neighborly, I actually was working as an EMT for about 1.5 years. And I would transition. It was kind of like a different transition, right? It's a medical, more medically oriented. So I would transition patients that were needing medical care, either outside hospitals or skilled nursings. And I would also transition in between assisted living, memory care, boarding care. So I was very familiar with how an environment affects a patient's ability to thrive
Mhm.
and also affects how their longevity of health. So just coming from that background, I think it gave me a really good insight into how environment can really better someone's, longevity and happiness too, because, the longer they live and the happier they are and the more healthy they are, they get to live very fruitful, long lives. So I think that transition into senior living was very insightful.
Okay. So how did you even get connected then with the company that you work for? You were EMT and then who introduced you to Neighborly, for example?
Yes, great question. I actually through LinkedIn, honestly, it was through LinkedIn. My initial pathway that I wanted to go was nursing,
Yeah.
actually. When I did apply to nursing school, I just didn't think that something was just kind of holding me back. And I think that was just, I didn't want to really deal with bodily fluids. So I wanted to be in a professional space where I can also still get the same reward that nurses feel when they help someone out.
Mhm.
Uh, and honestly, salute to all my nurses. I think that's an incredible job to have. I think they're so underappreciated, but I just didn't think that was the right job for me. So I actually applied to different senior living positions, and I met the CEO of our company, Anita,
Okay.
through LinkedIn, and we had a wonderful interview. And she told me a lot about how niche the senior living industry is. Not many people know about it. And so that's why I'm here to kind of tell more people about it, just like you, Dale. And, I think it's a very great industry to be in. It's very rewarding.
Can I ask you a little bit about Neighborly? What's the difference between Neighborly, placement versus any other type of company that does what you do?
That's a great question. I love getting asked that question because, so I joined Neighborly last September. And in those months that I've been with this company, we are all woman owned and operated company. We have, I think, 8 to 9 lovely ladies on our team that are with combined experience. We have over
Right.
55 plus years of senior living experience. And the wonderful woman that started the company, Anita Varelas, actually has over 20 plus years in the senior living industry. And I think that a lot of other placement agents don't really have that industry experience. That and then also we pride ourselves on a white glove concierge level approach, which means that we will handhold, we will do everything with our clients. And a lot of other placement agents tend to have other businesses on the side, but we are all we are all invested in this transition. So we can help with, the move
Mhm.
in terms of connecting them with movers that actually are on our team. And then we help with finding real estate agents, financial planners. We actually help with POA as well. When a senior, has Alzheimer's or dementia or just cannot make decisions for themselves, we actually help with POA, which is power of attorney. And we're very, very well connected, I would say, with many different professionals. So, with whatever they may need help with, we will do a warm introduction to that professional to make sure everything is going seamlessly. And then I'll talk a little bit more about how we can help different groups of
Yeah.
people. So, for example, if we get a referral from a case manager or a social worker from a hospital or skilled nursing, how we help them would be much different than if we were to get a referral from a community, for example. So that's a little bit about us.
Okay, here's an important question I think a lot of people should know about. What does a senior living placement agent do and how do you help families? And just one thing I want to say before you answer that question is I actually didn't know what a senior living placement agent was until around this time last year, and I didn't know it was a profession. So let's just talk about that.
Yes, I know. And that is not the first time I've heard that response. Honestly, when I go and see my families in person, especially in hospitals, they have the exact same response that they're so thankful that there's someone here to help guide them through this process because it's a very niche industry. And you'd be surprised a lot of case managers and social workers don't know the difference between assisted living, memory care, board and care, home health. There's a lot to know, and especially when they're in this, like, really dire emergent situation, they it's hard to think, it's already so hard to navigate, it's hard to think, so that's where we come in, and we first of all, we have a conversation with them about what's going on. Just a simple question, "What's going on? Why are you looking at, assisted living options, memory care options? Why are you just looking at senior living?" And kind of getting that background, we see maybe where to navigate and what to do in that circumstance because each circumstance is so different, right?
Mhm. Right.
Times they may not even need to be moved into a senior living, they could also go home with home care, and we have many partners that work in home care as well. So why work with the placement agent? We are very, very hands-on, first of all. We're very personable. There's a lot of online agencies out there that kind of just have a very initial conversation. They don't do anything at all afterward. We will stick with the family from point A to point Z. So until they are fully moved into the community, we will be by their side. And even once they are moved into to the community, we will continue to check in on them week first. So after they move in, after the first couple of days, and then 30 days, 60-day, and 90-day check in to make sure that that community was a good fit for them. And if not, then we will help them find another community.
Okay.
Um, but we were, just to make sure that everything's going okay. So we're very hands-on, I think, and yeah.
Okay. Well, do families have to pay a fee or to work with you?
No, they do not. We are completely free service. I think
Nice.
a lot of people love to hear that. So I've gone on tours with families 7 times to 8 times in a row, and other families, it was just once, a one and done deal. So we don't charge anything to our seniors or their families. We're just there with them through the entire process. And some families also need more help than others in terms of POA, right? So we help them fill out POA. If they need help downsizing, we will go through that with them as well. So it's just depends on the family, but doesn't matter what needs they have. We're
Yeah.
still free. We don't charge anything to our clients.
That sounds good.
Yeah.
And just, yeah, side note for anybody listening, POA, it's an acronym. It stands for power of attorney. Okay, thank you for that. Oh, and just also because I'm a realtor, it's just like when I think of a placement agent, they're kind of like in real estate, they're like buyer's agents where they show them around to different, like as a buyer's agent on a real estate side, I show people different homes and
Mm.
whatnot. And then if they like the home and whatnot, then provided that the seller is paying commission, then I get a commission. And that's how it's quote unquote free for the buyer that's working with me. And it's very similar on the senior living placement side too. So I just want to give clarification on that since a lot of people understand real estate. So, hey, so a question for you. You mentioned like independent living, assisted living, memory care, so on and so forth. And like, so
Mhm.
what type of senior living options do you specifically help families explore? Is it all of that stuff?
It is all of that stuff. So we went through a very rigorous training when we first joined the company in terms of differentiating between what is independent living, what is assisted living, what is memory care, what is board and care. I know that's a lot of words, but kind of says it in the word itself, right? So independent living is not, they don't get care, but there are meals that are provided in the community and they also get transportation. Usually, people of this category, seniors of this category, like to be independent. They are still driving sometimes. They are fully ambulatory, or they just need a cane or a walker. They just want to have a sense of community, which is why they kind of tend to move into independent living community. But moral of the story is they don't need care. And when I say care, I mean assistance with daily activities or ADLs, meaning medication management, assistance with grooming or dressing, showering, bathing, and also toileting assistance, right? Then that's where assisted living comes into play, where they may need one or all six of these ADLs and help with them. And then there's memory care, which is could be part of an assisted living or a bigger community in which they have other like independent living or assisted living, but memory care is those that are diagnosed with Alzheimer's or dementia and
Mhm.
maybe more progressed than their counterparts. So, and memory care tends to be a locked environment, and people kind of get scared when they hear that. But there are a lot of seniors that have dementia or Alzheimer's that tend to be a wander risk. And what is a wander risk? Someone that doesn't really have a sense of awareness in terms of where they are and where they can go. So they kind of just tend to wander wherever. And then there's also boarding care homes, which are a standard six-bedroom family home, six to actually 13 beds. It kind of varies. But the caregiver to resident ratio tends to be a bit better in boarding cares because they get more personalized support. So it just tends to be a smaller environment for families that are more comfortable with. They don't want them in a very big community, if that makes sense.
Yeah.
So I help with placement in all four of those different communities, and all of them provide 3 meals a day. Housekeeping and personal laundry depends on the community. Transportation is included. So it just depends on the community. I mean, what they provide, but it's pretty standard throughout.
Okay, perfect. I'm gonna switch topics of questions. I'm gonna talk more about like common concerns and myths about senior living. Here's my first question in this category. What are the biggest misconceptions families have about moving a loved one into senior living?
That's a great, great, great question. I think to those that don't know what senior living is or have never dabbled into that realm, they kind of tend to confuse senior living with skilled nursing. So, a skilled nursing environment is a very high level of care in which nurses are, in the skilled nursing, and they're providing a very high level of care to people that have certain diseases that cannot be treated in a assisted living or memory care or RCFE community, right? So I think when they think of senior living, they think of putting their loved one in what they think is a skilled nursing, but that's not true. Um, a lot of these assisted livings are very beautiful, luxurious communities, and they usually have caregivers.
Right.
Some of them have nurses, so they're able to do that higher level of care. Obviously, it's more costly. Um, but that's one big misconception. Another one, and I think another hesitation, I would say actually, is they feel guilty about placing their loved one in a community. And I think that coming from an Indian family, I think my family is the same way. I think it's very common in immigrant families, especially, that they don't want to put their loved one anywhere else outside of their home. And I think the reason why is different, but in general, it's kind of a reputation thing. But what I've seen is actually the adult children's relationship and the senior their adult children and their mom or dad's relationship has actually become better after placing them in somewhere like a senior living because they don't have to take the responsibility of a caregiver anymore. And they're not certified to be caregivers. So, you're kind of putting their life in jeopardy if you just keep them at home and you think that you could take care of all their needs when it's going to be a lot. So, I try to kind of sit here and help them understand that. Obviously, there's also home care. Home care is an option too if they really just don't want to move outside their home. So there are options, but I think navigating that space, I would love to just sit down and talk to them about all their hesitations. And I've done that before. So,
Yeah,
yeah.
I get that. Yeah, just side note for those that don't know what home care means, that's just where in-home caregiver goes to the home where, that senior could what we call age in place. So next question is, what's the most common question or hesitation you hear from families when they start this process?
Yeah, I would say since I am the Alameda County representative, a lot of my clients kind of come to me about hesitations about budget.
Mm,
So finances, I think, is a pretty big hesitation that they have, and if they're able to afford something like this. And some of them I had to, what we do is we have low income resources. However, we're not able to help them to the extent that we really want to. So I would say budget. And then also, I think not leaving their house is also another very big hesitation. They don't wanna leave the comfort of their home that they've been in for 50 plus years, and that's when, I would connect them with someone like you, Dale.
yeah.
And then also, I would say even a cultural barrier. I think there's also sometimes a cultural barrier in which they hesitate to move into a bigger community because they don't think their culture would be appreciated. However, since we have the knowledge that we do, we know the diversity that different cities tend to have, and therefore their communities as well. So we kind of introduce them to that idea of that. Don't be so closed off. There are options for everybody. For example, there's this community called Aegis Gardens, and it is a primarily Mandarin speaking community, which is amazing because there's a lot of Mandarin speaking populations in the Fremont area. And to have a community that just solely just dedicated to the Mandarin speaking population is, I think, truly amazing. Um, and I think that's first of many that they have to create. But yeah, I think those are really some of the hesitations that I get from families.
Speaking of the families and this idea of like guilt, I mean, I completely understand what you're talking about. How do you help families who feel guilty or hesitant about transitioning a parent into senior living? How do you handle
Yeah, that's a great question. Again, coming from an Indian family, my family thinks the exact same way. Again, I think it's something that's common in many immigrant families. It's a reputation thing that they don't want to place their loved ones, in another environment because I think they would feel inferior almost. But kind of just telling them that there's a difference between being a adult child of your mom or your dad and a caregiver. A caregiver, there's a whole certification process that goes behind that. And why not let your loved one get the highest level of care that they deserve, as opposed to you taking on that responsibility and that relationship kind of dwindling a little bit because, there's a lot of pressure and stress on you. And I mean, if you were able to afford it, of course, I think that they deserve the best level of care, whether that be, again, what you said, in home care or placing them in a senior living community that has caregivers, has a good caregiver to resident ratio, and kind of going on these tours and getting a sense of what mom or dad would like, if that makes
Yeah,
sense.
that does make sense. Hey, let's transition to choosing the right community. Here's a question I have. What
Mhm.
factors should families consider when choosing a senior living community?
So that's a great question. So if they were to work with us, Neighborly Senior Placement, I have over here a folder that we love to give our families.
Uh-huh.
And basically in that folder, we have a couple different things. And one of them is a touring checklist.
Okay.
Sorry, I'm not able to see it, but it's a touring checklist in which we have all these different things that are listed that are good to look for in a community. For example, first impressions, cleanliness, how is the staff? How is their friendliness? I think one of the most important questions though is what is the caregiver to resident ratio?
Right.
It's very important. Some of these communities can become understaffed, and that's very important to look at and to ask that, and for sales directors to know that off the top of their head. And chances are that some of them do and some of them don't. And another good thing to look for is types of services that these communities are able to perform, because a lot of them are not able to do diabetic injections, Hoyer lifts, wound care. If it's like a wound, I believe stage 3 and above, then they're not able to handle that. That's a nursing level of care in which they would go into a skilled nursing.
Mhm.
They are also not able to do Hoyer lifts or two-person assist, but that depends on the community, right? Some communities actually have nurses that are staffed 24/7. So they are actually able to do all of those things that I just mentioned. So that's important to know. I would also say maybe asking the community, what does your ideal resident look like? Because some communities are more tailored to accepting more progressed residents because they have that higher level of care. And other communities are kind of mainly focused on independent living and assisted living, but mostly independent living. So they want someone that's active, that can partake in social activities, that's mostly ambulatory and able to get around themselves. So I think that's also important to look at. I think diversity as well. Also, I think response to emergencies, how fast is that response time? What I like to personally look for, since I used to be an EMT, is walk-in showers. Walk-in showers, if they were to have a fall, is there a cord nearby that they can pull? Some communities also have really high-tech motion detectors in which it's not a camera, but in case someone were to fall, it would immediately be able to look at their kind of location and their position and see exactly how they fell so that that report can get transcribed to medical professionals. So I think those are some of the few that I look for personally. If there's anything else that you may look for, Dale, you can
I
let me
mean, that
know.
was
But
amazing. So side note, it's just like working with somebody like you know the right questions to ask. Somebody that's new to this might not even know what questions to
mm,
ask, let alone the vocabulary. You know what I mean? Yeah. So next question I have is, so how do costs vary between different types of senior care, and what should families know about, financial planning?
So that's a great question as well. I think that's like the number one question I get asked. So communities range anywhere between, since these are all private pay communities, you will have to pay an out-of-pocket cost. And I've placed someone as low as 3,500 a month.
In the Bay
And I think
Area? Yeah, in the Bay Area, by the way.
the Bay Area, I
Okay.
know,
Yeah,
in
I
the
didn't
Bay
I mean,
Area,
that
yes.
sounds lower than I
This
thought.
was
Yeah. Yeah.
I know. It was in the East Bay in
Okay.
Oakland. So location obviously does matter, right? So, I mean, if you were to place someone on the peninsula, that would be something that, 3,500 is unheard of.
Okay.
But obviously Alameda County is a little different, and so is Contra Costa. So on average, the families that I have placed have been able to afford around anywhere between 7 to 15K a month. And 15K is definitely the higher end. There also are luxurious communities that are even more expensive than that. But again, most of the families that I place are around, they're able to pay around that much per month for a couple years. So we want to make sure, as a placement agent, I really want to make sure that my families are able to afford something of that high cost for a long period of time until, they're comfortable. I would never place someone in a community that they are not going to be able to afford for a couple years down the road. So another thing is that there are a lot of financial advisors actually in our network that are important to work with and that I love to set my families up with, because there are some questions that they can answer that I cannot answer, right? So I think it's important that they get the best professional advice when it comes to money, because last thing I would want is for them to run out of funds. And financial assets come in many forms, you know, property, there's cars, there is also maybe veterans benefits. They could have long-term care insurance, and others too. There's pension, annuity, retirement benefits, a stock option. So all of those combined together they can help finance something like senior care. So I think it's very important to look at all aspects.
Okay. Yeah, it was a very comprehensive answer. Thank you very much.
Yeah.
What are some of the red flags that a facility might not be a good fit for a client?
Great question. So, and regulations they have to follow. So, if you were to go on the Department of Social Services, specifically press on the California Department of Aging, then press on Find Licensed Communities, you will see, you can press on that community. You can click on their license, and there could be citations. And if there are citations, that could be a red flag. So they have audits, would be a high turnover ratio. So what does that mean? It means that the staff is not keep changing every year, every 2 years. Good communities will do their absolute best to retain their staff. So, for example, if you were to ever go on a tour, a sales director might ask their caregivers, "Hey, how long have you worked here for?" And they're so confident in asking that question that they will get a response that could be anywhere from 10 to 20 years. And that's a good amount of time for a caregiver to be at a community. And yeah, so I think that, and looking at, doing your research. However, working with us, we will have done that research for you already. We will never recommend a community that has terrible care. So, yeah.
Yeah, I mean, that was great. You already talked about some of this, but like maybe you could expand a little bit more. So, how does working with a placement agent make the search process easier? I mean, I don't even know how long it takes when somebody works with somebody like you. How long should they even expect to get into a senior living community? I'm not sure if this is in months or even a week, or if it's super, if it's long or fast.
That's a great question. Actually, Dale, this past week, I did a same day placement
Oh wow.
right out of the hospital within 24 hours. So we are able to work very quickly. That doesn't mean that they should be waiting until the last minute because that would make everything so much stressful. We can do it, but trust me, families are so much more stressed out at their wits' end, ready to like scream at someone in those 24 hours, and I will take the heat. I will take the heat. But I don't mind that. But the preferred method of transition
Yeah.
is definitely to give as much time as possible to this. I'm working with families that, sometimes it's a 90-day thing, sometimes it's a couple months that they're looking, they just want to start now.
Yeah.
Other families are like, okay, I want to move next week. Like, I need to go on tours right now. And usually those are the clients that I usually
Yeah.
get. Those are hot leads. But, it really depends on the family. It could be anywhere between, 24 hours to a couple months down the road. Um, so I would advise families to, once they start thinking about it, let's get a move on. So let's start touring communities. Let's make sure everything is in place. Let's make sure we set you up with a financial advisor, financial planner, whoever, to make sure you have what you need to move your loved one into the community.
Yeah, I mean, along here, I want to ask you this question. How about this? Can you share a success story of a family you helped find the perfect senior living option where, you kind of where if they hadn't met you, they wouldn't be able to find it? Just, you know, anything, do you have
Sure.
a situation
So
like that?
yes, plenty of situations. I would really say all my situations are like that. It's really hard to pick and choose one, but I will say the longest time I've worked with the family, this was, I think, 2 months. So the daughter, I was in contact with the daughter. She lives in New York, and she was trying to help her mom find a senior living community in up here, so in Northern
California?
California.
Okay, got it.
Yeah. Well, so the mom was from Menlo Park,
Got it.
and she and the daughter also had a certain budget. So I would have found her a community in Palo Alto, Menlo Park area, but since they were a bit more pricey, I had to find a community within a budget in Alameda County, which I did. However, since the daughter was so far away, she needed someone to help go on tours with her mom too. And we also help provide transportation to some of these tours as well if the senior is not able to drive or if they're not able to get there themselves. We help provide tours. I also helped her out with POA. I also took the mom to a DMV because she didn't have an ID.
Yeah.
So before you move into a community, and so we got our 602 medical paperwork. We set her up with a good doctor, got her insurance records in. So all of that, it was a lot to go through, but I'm so glad that the daughter was very patient and she was involved in the process because otherwise it's incredibly difficult. So that was a very good success story. And once we actually toured 4 to 5 different communities together before we found the right one. And now I mean, I've checked in on her 30 days, 60 days later, and the mom loves it. In the beginning too, she was like, "I don't wanna go to an old people home. I'm not an old person." And now she has friends there and she's
Nice.
drinking wine, she's going to happy hours, she's watching movies every now and then. She has a heated pool, so, she's
It
very
sounds like
happy.
luxury. It sounds like a really good lifestyle, actually. Yeah. So poor thing. Uh,
Well, and actually the state of her home before, it was not safe. She was living all alone, her husband had passed, and the state of her home was definitely not a safe environment. It was lots of fall risks. She was eating frozen food almost every day, and, she had some kind of an MCI, so mild cognitive impairment, which caused her to have short-term memory loss.
yeah.
So, and that could progress. So I'm glad that she's in a community where she'll be looked after, she'll be taken care of, while her daughter is all the way out in New York.
Yeah.
So
Well, you help improve people's quality of life, it sounds like. Yeah.
yes, yes,
Yeah.
I do,
Yeah.
and it's
Yeah, you
really
do. Hey, what's the most rewarding part of your job?
the most rewarding part of my job. It's just that's so hard to answer because there's so much.
Yeah.
But I will say once everything is done and settled, they find the right community. I just love to see the family come together in the new apartment or the new home. And we're all just sitting there and we're like, we did it. We did it, and it's just like a big congratulatory moment, and I've been with just the senior themselves and had that moment, and I've been with a huge family in a room where they all, we all were just smiling at one point, and that's how we knew that, this process, even though it was so stressful, you can see the relief on their face. I think that's the most rewarding thing for me is that they can go home or the family can go home knowing that their loved one is in a community where they'll be taken care of and they can visit whenever they want. So I think I just want them to relax and just go home and have more time to themselves and, focus on themselves while also caring for their loved one. So I think that really, yeah.
Yeah. What advice would you give to a family who does not know where to start?
I would say don't be afraid to ask for help because there are more people in this industry that will reach out, but there's only so much reaching out that we can do, and also only so many families that we can reach out to for help. If the family takes initiative to reach out for help, I'm sure there will be a hand in the industry that they can grab. Because there's so many amazing professionals that I've met in this industry. And if they grab my hand, I will not let them down. I will do my best to do whatever it takes to make sure that they get what they need. But yeah, I think the biggest piece of advice would be to don't be afraid to ask for help because a lot of families think that they could do it on their own and maybe they can, but it's just nice to see, to kind of lean on someone for support during this stressful time and there are people that are willing to take that on. So, yeah,
Yeah.
that would be my biggest piece of advice right
Or
now.
here's one of my last questions. Is there anything else I should have asked you that I didn't ask yet?
I I would say maybe I think a good ending piece would be to see how you and I Dale could work together to help out families and how what you do can also be in concurrence with what I do. So maybe that could be a good ending point because I know you specialize in also a certain type of real estate transition. And so I guess maybe how we could work together to help a family out.
Absolutely. It's like I partner with, placement agents and also senior living communities, obviously, because one of the financial pieces, especially since, as we know, living in a senior living community is so expensive. A lot of times, it's not all the times, but a lot of times they need to unlock the equity quickly on the real estate aspect of things, and that the home needs to sell or whatnot in order for them to move in. So yes, I'm
Mhm.
a realtor, and one of the things that also makes me different from a realtor is that I could actually buy the house if we need to go even faster. So definitely would love to even chat with you more about that even offline. But just definitely we looking forward just partnering with you and helping you out, and likewise you helping me out. So and just wrapping this up, wow, this has been such a valuable conversation. Thank you,
Yeah, of
Tanvi, for sharing your
course.
expertise on how families can navigate the senior living transition more smoothly. But before we wrap up, how can families reach out to you if they have questions or need your help in finding the right senior living community? There's any
Great.
contact information if you want to leave over here?
Yes. Yes, I would love to. So, basically, my you can contact me directly through my number. My number is 408-689-8895, and that is my work number. So, it's not my personal. So, don't worry. You can reach out to me, and then also that's the quickest way to reach out to me. And then you can also email me. And do have a long email, but it's my first name Tanvi at neighborlyseniorplacement.com. That's another way to reach me. I'm also on LinkedIn, Instagram, and we have our company has a general YouTube and a Facebook, so you can also reach out to us there, and I can link them in the description if you'd like as well.
Yeah, we'll put it in the
Uh,
description box of this YouTube video as well. And then for those that are listening this just in the audio only, it's just, you heard her phone number as well. Anything else, Tanvi?
I would just say to the families that are kind of listening to this, I know it's a very stressful time, but again, don't be afraid to reach out for help. There are some people that are willing to help more than others, and I hope that whoever you decide to work with will do you well by by your expectation and your standard. But I just wanted to thank you, Dale. Thank you for having me. This was an amazing conversation. I'm very excited to see the potential clients and families that we can work with together and help out as well. So, thank you for your time.
You're welcome. And lastly, and for those of you, again, watching or listening, if you're feeling overwhelmed about selling your parents' home while transitioning them into senior living, I'm also here to help. So you could schedule a free consultation with me by clicking on the Calendly link in the description box of this video below. Or you could learn about my own services by going to www.simplifyseniortransitions.com. If you have a quick question, you could even DM me on Instagram at soldbydale. And if you found this interview helpful, make sure to like, subscribe, and share this video with someone who might need this information. Thanks for tuning in, and I'll see you on the next episode.